As all of you know from the news, that Darfur regions are heavily affected by conflict, and unfortunately, it's currently is still heavily affected by the conflict. So healthcare services and data from these areas are very scarce. However, the other part of the countries, the northern and eastern states, are more stable. So healthcare services there are being restored, and people are working to like the bridge to bridge the gaps. And some states were affected, and then they got in recovery phases. So also like development projects, people are going back. So we have many health gaps. For example, if we want to talk about health system building blocks, it can go like many people are going back, many IDPs are settling back, and then you have environmental problems, data problems. So yeah, it's a very challenging condition. If you have any further questions, please feel free.
Thank you, Khulud. Maybe I have two questions. What do you think that the world needs to know about what's happening in Sudan in terms of, for example, health crisis? And also, what would you like to see from the, global community, for example, this audience and our wider networks? Thank you.
Oh, okay. Thank you. I will go a little bit political here because unfortunately, like wars and countries of interest, they go according to the international agenda. So when the country is not in the international agenda, it's get represented and underreported in the news. So what I need like people to know about Sudan, that there is a huge humanitarian crisis in all aspects, in children, women, infectious diseases, health system, and it usually goes unnoticed, unfortunately. And the second thing, like more support is needed, more technical support, more investment in low resource conflict affected settings. And unfortunately, even like the NGOs and with the cut of funds, countries like Sudan get more and more less prioritized, because now the country like cannot provide the documents for example, the Global Fund, like with a full report of M&E, because the country itself is going under a continuous change and instability. So any technical support, like academic support for the healthcare providers there, because like conflict happens, all the brain drains happens at the same time. So people in field really need like money, of course, funding, education support, joint collaborations, joint research, and yeah.
Thank you, Khulud, for sharing. And I want to ask maybe Dr. Zacharias or Dr. Fitzgerald if you would like to share any comments on this. And if not, then we can also start talking about our event today. Who would like to go first?
I'll jump in. Well, first of all, thank you so much for sharing that update about Sudan. I think increasingly we're seeing that the world is connected and struggles everywhere are connected to struggles anywhere. So I think as global and planetary health, people that are interested, whether no matter from what discipline, it concerns us. So I'm just very grateful for this opportunity to connect with all of you and hear from senior professionals and junior professionals. We, no matter what, we have expertise in our particular context. So I see everybody here as an expert in their context or area that they're working in our base. And so thank you. I'm going to not talk too much. I think we can come back to introducing the speakers, but I'll turn it over to Dr. Zacharias. And thank you, everyone.
Okay, thank you. Hello, everybody. Some of you already know me. I'm a medical doctor from Mexico, and I was the founder of MultiPOD Mentoring about 10 years ago. My specialty was infectious diseases and then international public health. So I'm delighted to be here. And I have a request if you can do it. This is a video conference, and I very much would like to know you, the ones who have a video, a camera. It would be great if at some point let us meet you almost in person. Otherwise, it's like a phone call. Sorry about that, but if you have a camera, it would be good if you join us. And then I pass the microphone to Charlie.
Okay, thank you, Dr. Zacharias. So let me welcome everyone formally again. Thank you for making the time to join us today. So CGHI and MultiPOD, we have been collaborating and trying to organize intergenerational dialogue because, CGHI, we are the Coalition for Global Health Innovation. We are a youth-led nonprofit with over 100 young professionals from over 40 countries, 6 continents. And we are very passionate about building bridges between cultures, continents, disciplines, and people, so that also generations, so that we can, share our knowledge from different parts of the world, so that we can come up with more inclusive and equitable policies and practices for global health. And this is probably our third event now, and I'm really grateful that you guys are joining us today. And we will keep this conversation going as well as we move forward. We will also identify and invite mentors in advance and share their profiles so that our mentees, our young professionals, can also come up with more targeted questions for the mentors. But yeah, without further ado, maybe at first I will invite the new director of MultiPOD Mentoring, Dr. Molly Fitzgerald, to tell us a little bit more about MultiPOD. And also they are taking new mentees for this coming year, for this year. So please check out their website as well. And then I will invite the Dr. Zacharias to introduce our speakers for today. Dr. Molly Fitzgerald, would you like to talk a little bit about MultiPOD? Thank you.
Sure. Thank you so much for that introduction. And everyone, again, I will just keep this brief because I know that we want to jump into the conversation. But I think some of you know, some of you may not know about MultiPOD mentoring. It's been around since 2016. Dr. Zacharias founded it, and is a multi-generational, multi-country, multi-discipline mentoring program, free of charge, virtual. I think we're going to try to leverage sort of that virtual capacity even more in the coming year. And so MultiPOD is pathways, opportunities, and oh my gosh, pathways, opportunities, and decisions. So it's both. There's some structure, but it's really centered on the mentor and mentee pair. And the other one thing that I want to emphasize is it's really not. There's no hierarchy. It's mentor and mentee working together, and the hope is that this is valuable for everyone. So the workforce is, got like 4 generations now. So there's an opportunity for everyone to keep learning and connecting. So I'm very excited to be here with you, and please reach out if you have any questions about the program and want to get involved. And with that, I will hand it, I guess, back over to Charlie or Dr. Zacharias.
Thank you, Dr. Fitzgerald. Yes. And Dr. Julia, I'm gonna make you wait 2 more minutes because I see our member, Matt, is joining us. And he used to be our intern, and now he kind of graduated from our internship, and he started a CGHI chapter at Emory University in Atlanta. So I would love to introduce Matt. Matt, are you available to tell us more about CGHI at Emory University?
Sure. I'm sorry I don't have my mic on. My environment isn't the best right now. But hi, my name is Matt. I was a partnerships intern with CGHI, and now I'm currently the chair of CGHI's ATL. We're essentially a global health publishing and advocacy club which is an official chapter of CGHI. We have our branch personally touches upon Emory University and now Georgia State University, so we're multi-school now. We have our first general body meeting today at 8 p.m. during Eastern Standard Time, so it's very exciting to see everyone come together, having our first in-person meeting. Our primary purpose is to essentially publish for global health. Students will group on based on interest, and then they will, quote, make it global. So, and say cancer access in Ethiopia. They would find a passion and then they would do their research. They'll look for it global. Then we have three publishing options. They can either write a publication and we'd offer them guidance. They can write a blog or they can do a social media post. And me and my exec team, we're with them the entire way through. So a lot of this is very exciting. I'm excited to continue posting about it and at CGHIXATL on Instagram. It's been a wonderful experience, and a lot of it's thanks to Charlie and the intern advisory board. So thank you for that again.
Thank you so much, Matthew, and we're very, very proud of you, and we cannot wait to see your organization, your chapter grow over the years to come. Yes, so Dr. Zacharias, would you like to introduce our first speaker, Dr. Julia, and then we'll also after Dr. Julia's masterclass, we'll open up for questions and discussion, and then we have another representative of the new generation, Miss Eliza, and then we'll also introduce her after the first section. So over to you, Dr. Zacharias.
Yes, thank you very much. I'm going to say just a few words about Dr. Julia, because we worked together about more than 2 decades ago at the Pan American Health Organization. And she's worked extensively in countries in Africa, especially in Angola. And she has published several articles, and I still keep receiving notifications that that article is known by many people and quoted for many people. So I would like Julia to introduce herself. And please, Julia. She's in Madrid now. And she's disappeared.
Maybe she's, oh, okay. Yes, Dr. Julia, you are, okay, let me request you to unmute yourself. Do you see a button popping up? Are you able to unmute yourself?
Oh, yeah.
I guess you're on your phone. There should be a button somewhere.
It looks like you're hitting the video button instead of the mute button.
Or you didn't give access for your mic for this app. Perhaps you need to quit and then join again. If we have technical issues, then should we invite? Let's just give it. Yes,
Now
we can hear you.
Sorry.
Thank you. Over to you, Dr. Uria.
Hi. I was having a postprandial crisis. Here we are. I'm in Madrid, and this is like 5:20 in the afternoon. So anyway, thank you, Dr. Zacharias. And I have to apologize to start with because I didn't dare to answer your emails or not even say, okay, I got the message and whatever. So I apologize for that. I managed to do some things that might be of use, and I have been centering what it is not written in the books. So we can start with that. And if you want some other issues to be brought up in the future, so I'll do it, or I'll do a more formal thing, which I can do it comfortably. So I am Julia. I was a late boomer, let's say, in this thing of the humanitarian world, international cooperation, etc. I had always wanted to go to Africa and that kind of thing. But on the way, I didn't know what to do. I was somehow forced to be a doctor by my family. So it was then when I finished that I say, okay, I want to go and do good somehow. So I started as a volunteer in India, in Calcutta, and then almost by chance, the Spanish International Aid was requesting doctors to go to Equatorial Guinea, and I went there. No experience at all, just my 3 months volunteering experience in Calcutta, which is to be narrated in a movie somehow because I was completely lost. And so in Equatorial Guinea, I was there for 2 years, mainly being in charge of a 100-bed hospital and doing mostly clinical work when I was supposed to do management. That was my first issue that I could not understand further, But in the future, I did. So after that, and against my will, as usual, I came back to Spain and start studying. I did a diploma in community health, some epidemiology, some public health, a bit of everything. And then I went with MSF. I went to Kenya and then to Somalia. And after that, I came back to Spain. I kept on studying, went back with MSF to Kenya again. And then there I was the medical coordinator by chance again. And I stayed there 2 years, and I thought the amount of work there was huge for me, and I didn't have the knowledge. I had no free time at all because I was working on studying or asking somebody else. It was the time when internet was starting through the phone, and we just had a very little access to communicate with the outside of Kenya or in Kenya with other colleagues. So after that, I went to South Sudan to an emergency with Médecins du Monde. And after that, I just thought, okay, I need to stop. I know nothing. I had to do a master's or whatever it is because I'm completely confused here. So I went to Boston University and did my MPH in public health, international health. Then I stayed working at the university there, which I enjoyed immensely. But September 11th came along just to pull me out of my comfort zone again. And lots of opportunities were coming from Europe. and I did several big interviews around the world. Like I went to Zimbabwe for 4 days for an interview with DFID. And the other one, I don't remember where it was, but it was like very exciting and with, because these were like big companies with big projects, HIV/AIDS mainly concerned. And then I moved on to Angola somehow, and I stayed there for almost 11 years. Somehow against my will because I wanted to move out. It was a long time, but I was comfortable. And I got engaged in one project after another, and that was it. And again, I came out due to family reasons. That was 2 years ago. And I've been in Spain since then. So messages Well, somebody says that life is what happens while you are planning, and I completely agree with that. In life, and also when we insist on planning all these projects, these chronograms and everything, something happens that changes everything. So I'm not a believer in planning so much now. You have to do it for management reasons and because you have to be reliable to your funding entity, but things may happen. Things may happen and you have to be ready for that. So I have tried to somehow follow the email that Molly sent to answer those questions. Let me see if I can find it. Here it is. So regarding what lessons from your career have stayed with you the most, like for me, is always you have to be an observer. You have to learn to observe, especially at the beginning. You have to take your time. Do not be in a hurry to start doing things or to start showing that you are a great value to your organization or to the country you are serving or to the people, because that takes time to be productive and to really be somehow effective and efficient. You have to take your time. And second thing would be always, and you all know that because I can see here a very international group with very different backgrounds and with great experience. So maybe I'm just narrating a movie here that you already know. But anyway, always consider the culture of the beneficiary countries, policies and norms, but also informal ways to do things. Do not underestimate these ones. Those are the main ones, even on top of policies and rules and norms. Okay, always study. You have to work and study and go back to the book or talk to your colleagues or whatever. Now it's so easy. Now it is so easy. Also, consolidating all this experience and your studies within a master's degree, I think it is a very important occasion to exchange opinions and to strengthen capacities and abilities and so on. I think a master is a must somehow. And I'm meaning a master and like 1 year cycle of study altogether to move on. Also, keep your ears open, networking. But networking is not only LinkedIn or whatever that is. Networking is go and have a drink with people, talk to people. The net is there and everything is perfect and I have this and I have done that, but nobody's going to tell you about, oh God, this came out wrong, I messed this up, and that is the opportunity to learn and not to do it yourself. So have a drink with your colleagues, with other people, pay for those drinks, especially in the countries you work in, where people income is not that high. Talk with people, share. Also, that was keep your ears open, but you also have to keep your mouth shut. Why? Because even you are in the field, you have to be very cautious. You never know whom you are talking to. Even if you are having a drink and you are talking personal things, which you can do, why not? But even if you had those personal moments, you have to be very, very cautious with the information you circulate. Okay, especially regarding project or donors or whatever. And for me, there are two main words, not only at work or in projects, but everywhere. That would be resilience and coping. You have to cope. You have to cope. I mean, I don't like this because I don't agree with this. My project manager said that we have to do that, whatever, and I don't agree or whatever. Okay, you don't agree, but your project manager said so. You do it and you cope with it. And if it makes you sad, you go and have a drink with your colleague, or you talk with your family or friends in the internet through WhatsApp, but you have to cope with it. If not, you'll be moving out soon by your choice. Not because something happened and you have to leave the project, but because you said, okay, I cannot go anymore. You are going to be frustrated, sad, and that is not good because you have to enjoy what you do. Especially in this work, we have the opportunity to meet great people. Most of the times we have great nature, and even we all know that projects effectiveness somehow are not that 90% that we all wish that were. We have the feeling that we are doing something very satisfying. And just the only fact of having people nearby and being able to teach anything, even Excel, or even how to do a PowerPoint or whatever you can do, that is immensely satisfying. So really, we are very, very lucky to be in this job. So regarding what do early career professionals often underestimate or misunderstand about global health work, I wrote also a couple of points. And what I have found is that when we are hired, we are like very proud. Oh, I've been hired for this. This is because I'm good at it. Or like I have an example. Sorry, I'm going to grab some water. I have an example, especially with languages. Everybody, we write in our CVs, do you speak Italian? Oh yeah, I'm very fluent. And then you just know how to ask a pizza in Italian. So whenever you go to the country, you have to give time to learn the language, to do all these things. Take your time. Even if we want to start things very quickly to show that we know and we are capable and we can and we want that recognition thing, take your time. That's the smartest things I can say. And also mentorship, coaching, support from colleagues, it's always advisable. Sometimes we don't ask for things because we are, oh my God, if I ask for this, I feel ashamed because I should know this or whatever. No. You go and ask. It doesn't matter what it is. You need to wait until you have a perspective of the context you are working in. A perspective from somebody that is more experienced and knows the specific setting. Understand daily life concept, like time. Okay, time is not the same here as in Angola, as it is in Angola, for example. Time is not. Why? We don't have the same means. We have different factors that condition every activity, you know. Also, you have to understand poverty, others people, way of living, their sustainable livelihoods, their income level. It's so different here and there. And also we have to understand corruption. Okay, corruption is bad, but sometimes projects do not, I shouldn't be saying this, but sometimes projects do not move on if you do not allow the certain percentage of corruption. Let's say you can move between a 10 and 20%, okay? You know that is not right, but okay, if I don't do it, I know this will be blocked, and I'm going to have lots of problem executing the budget or any other things, so be cautious, but you have to cope with it somehow in a smooth way, I should say. And regarding how can young leaders better navigate the gap between policy research and real world practice? Well, what helped a lot for me was, of course, studying. The master's was excellent. I know Dr. Zacharias is there, but I have to say that I could not have survived the WPAHO without Dr. Zacharias. I already had my master's, but working with him was the next level. He provided me with the side of it, which without him, it could have taken me probably a year to notice what is all this about, what is this here? What are the movements? How do we work? All that kind of things. Finally, malaria protocols, epidemiology, and whatever, they are always there. And you go home and devote a couple of hours and study. But corporative issues and funding issues with the financing entities or relationships with the local ministries of health or agriculture or any other, hey, that is really special. That is really special. And if somebody, and nobody does that, let me tell you, if somebody help you on seeing that clearly or just transmitting you their opinion on the situation, you have saved lots of time. Lots of time. Okay, so I'm lost now. Okay, better navigate the gap between policy research and real world practice. Of course, studying international meetings, all these APHA conferences, even national ones or whatever, I think they are very, very important. Very important. We have to be on the loop. What is trendy, what is fashionable, it sounds horrible, but that is the way it is. That is the way it is. You need to know where the money is and what is the approach you have to give to your proposals and what do funding entities and governments want. Okay, and agreements they have reached. Another thing, what advice would you give to someone hoping to build a meaningful, ethical, and sustainable career? Yeah, thinking on that, take your time to decide what you want to do. Well, I think in our field, it doesn't matter whether you say, okay, I want to become a doctor and go to Africa, because then you may change to epidemiology or you may change to another thing once you explore an area or the other. But take your time. Don't feel that you are losing time because, okay, I did this, but now I'm not that happy. I would like to change, but I pay this amount of money to do this master's, for example, and now I want to change. What should I do? Whatever. Go, move on. Move where your heart and soul and your external factors indicate you. Move. Don't be scared on that, okay? And of course, making a decision is always good. The better you do the decision, the more time that you save. But sometimes we just don't know, or we just have not been exposed enough to certain issues, and you need to explore them. Okay, I think the last thing was looking ahead, what challenges or opportunities should the next generation be preparing for? Oh my God, this is, well, you all know, big political changes, we already are. And the other thing is artificial intelligence. artificial intelligence is everywhere now. It's a main topic of discussion. My point of view, and I have not that experience, I'm using ChatGPT once in a while, and somehow I was reluctant at the very beginning, but now I've made it my ally. Somehow we are somehow working together. And I think artificial intelligence is here to stay. It's going to be moving on. So we have to partner with it. We know what it doesn't have by now and what you can provide it, so that the output of it, of what you want and the artificial intelligence can give you, can be something better if you do it alone, let's say. So, and of course, the situation with the United States and all this funding being collapsed, it has been, I don't know whether that will change, but for what I know from some colleagues or friends is that there are lots of humanitarian workers, international workers out there looking for jobs now. And many projects have been canceled and whatever. Another thing now that I'm thinking is, like, for example, what I find is that some countries are reluctant to hire international staff. Why? Because of cost, and because somehow after all these years of support, they have built big capacity. I mean, that is amazing. But there's a couple of things that countries still don't have. That is statistics, epidemiology experts, and financing experts. Okay, finance consultants. That for the time being is going to be in the let's say in the hands of expatriates. Yeah, probably they will change. So I'm not sure about what in the future, what will be financing priorities. I don't know. Maybe you tell me about that. So one big thing that I'm forgetting is about teamwork. We have to get used to work with people. And I know there are some people that don't like people, but it's not a matter of liking, it's a matter of, adapting and moving on. And make mistakes. You are allowed to make mistakes. Don't feel guilty or don't feel bad. Mistakes makes you move on. Another big thing is idealism. I think many of us, we go because we want to change things, we want to change the world. That is okay, but just keep it. You are allowed to be idealistic in the beginning. Then you have to change to be realistic. Otherwise, this is a no-go thing. Okay, you have to keep it real. You have to know where you are and the context and the politics and policies you are surrounded with. And that would be it. I am not sure whether I have forgotten something very, very special. I don't think so. If not, I'll get back to you in the next meeting.
Thank you, Dr. Uria. Thank you so much for this very, very genuine sharing of your knowledge and experience. And I really learned a lot from what you shared. And I especially love when you said, when you go to this, can people hear me, by the way? Yes,
Yes.
great. Sorry. Yes. So I especially love when you said, first of all, I'm very impressed that you worked in so many different countries. And I really admire when you share that you think it's very important to understand the local culture, understand the different concepts about time as well. Because also I studied in the Netherlands. I lived there for a long time, and I lived in Egypt for a long time, and now I lived in South Africa for a long time. So the concept of time is very different in these countries. And I think especially now I work with locals, like I study with locals. So I from their stories understand that, like for example, the daily commute is very much of a struggle, right? So we have to understand why people are late. We have to understand the realities that people live in. So I think it's extremely important for our generation, especially because inequalities are being widened. It's not getting better. And we want to be a new generation that understands cultural differences and just different realities better so that we can do better when we work and study in different countries. So thank you so much for highlighting that. And also the part when you were saying that, go socialize with your coworkers, go socialize with your local friends, go socialize with everyone, learn from everyone, start the conversation. Yes, so thank you so much. So I just want to open the floor. If anyone wants to ask any questions or share any comments. And first, Amina Ahmed, I see that you wrote two beautiful questions. Would you like to ask them yourself, or if you prefer me to ask for you? Feel free to unmute yourself if you want to. Amina Ahmed. Okay, maybe I'll ask for you then. So Amina asked, for clinician interested in global health, does specialty choice significantly influence opportunities, or is systems experience more important? Another, maybe first question first. Yeah, Dr. Udia, would you like to respond?
Yeah, can you hear me?
Yes.
Oh, okay. I would go for a broad thing initially. Being a GP is completely fine, because then when you get immersed in whichever context you are, you will start deciding whether you want to go more into maternal and child health care or epidemiology or whatever it is. In my personal experience, I was a general practitioner. After 2 years, I started doing epidemiology due to a measles epidemic. Then I realized, okay, what I can do here can be done by the nurses and the one doctor that was in that 100-bed hospital, but I should do paperwork, like data collection and all that. And I ended up doing public health and management most of the time. I don't know. Yeah, that's my experience. I would go broad, and then you can narrow the to specifics disciplines depending on your likes or desires. I don't know.
Thank you, Dr. Udia. Another question from Amina is, what makes clinicians successfully transition into health systems leadership roles if there's one thing they should prioritize?
What makes clinicians
successfully transition into health systems leadership roles if there's one thing they should prioritize? Thank you.
Well, with clinicians, I have noticed that one big issue is that you have to adapt to the to current technology. For example, we had this doctor in Kenya he was a GP, but he was such a good clinician. And he wanted to do blood tests to see all kind of things to those nutritional centers population, and we didn't have the means, so he got frustrated all the time. So I think that is a must. You have to adapt to the resources. And then the issue with the leadership in health system, I think will be in this way. You always have to adapt your expertise to the resources you have, and you have to be well accepted by the ministry so that you can convince them of whatever things you propose to move on with health services or health system in that particular country. That is a very important thing. You need to do whatever it takes to create even personal relationship with the ministries of health that you work in the foreign country, to move things on. Then you become great friends and they'll stay forever. But if you work completely and they trust you and you trust them, you'll have lots of things achieved, and the project will run smoothly.
Thank you, Dr. Wulia. Are there any more questions and comments from our community? Yes, Elisa, please go ahead.
Hi, Julia. Thank you so much for the talk. I have one reaction to one of the points that you mentioned. Sometimes corruption, or what is believed to be corruption, in a lot of contexts is deemed necessary to make the project work long term. It really, I think a lot of my informants working in Asia would agree with that. Sometimes gift giving or just sharing with officials a bit of money might make things work faster and even, facilitate long-term relationships. I'm wondering whether you can elaborate it in, African context. And my second question is also about African context. A lot of people, especially media, have highlighted the challenges caused by Trump's funding cuts. However, I believe that many African countries have been used to these fluctuations of funding. Some conflicts are prioritized over the others. Some communities might be prioritized over the others. Some communities were prioritized, then deprioritized, then reprioritized. So I'm wondering whether you have seen some resilience of communities so far in the wake of funding cuts. Thank you.
I'm sorry. Can I before Julia answers? Eliza Chan Bu is from Vietnam. Are you in Hanoi right now?
Yes.
Yes. I just let me tell you, she was with us. She's a former mentee in 2024.
No, much longer than that. I'm much older than that. Sorry.
22, and she's a journalist. She's an excellent writer. I would let her introduce herself because she has a very wide and interesting experience. And I take advantage of introducing her to let you know that at MultiPOD, we accept anybody of any profession, of any country. We have had close to 400 mentees and 71 mentors, and we want diversity. We want to have people from as many countries as we can. We have more than 100 countries in the program. We have had more than 100 people in the program. And the program is about your future. Please remember that, how to find a job, how to enter a higher degree or higher studies at the university, how to deal with situations at work, as Dr. Julia was mentioning, and also if you want to do something else. Again, make mistakes, but don't be afraid of making mistakes because you can always correct your path. MultiPOD is pathways, opportunities, and decisions, and we can help you with that. So please apply. Look at what I mentioned in the chat and also the website, because you will find some ideas there about how to be a consultant. I started as a consultant at the Pan American Health Organization. So don't think that you won't be able to work in global health, because you can work as a consultant even if you have a very, very focused specialty. For example, I was an expert in infectious diseases, and my first assignment was to work in Jamaica, helping them develop their STD program. So I stop here, and please, Chang, Eliza, please introduce yourself, and then please, Dr. Julia, if you can answer that question.
So to Charlie, and those in the room that celebrate Lunar New Year, Happy Lunar New Year to all of you. Since Charlie and Julia mentioned time, I have to disagree with Julia on what she said in the beginning, that she is a late bloomer. I don't think we should talk about early or late bloomer. You are a bloomer in your own time. It makes me feel very, very old. All right. So I was a mentee actually in 2021, not 2022. And my degrees are all in humanities, so I don't have any health-related background. Currently, I'm covering human rights abuses across Vietnam as well as Southeast Asia, and health is only one topic of mine. Currently, I'm working on a long-term project on secondary trauma faced by human rights defenders as well as advocates. Now, sharing with mentees, I just want to emphasize, I want to introduce the very first exercise that my mentor taught me on the very first session, which is reflecting on my health story. To be honest, I was born in a very poor family in Vietnam. We live in urban Vietnam, and actually few people talked about the urban poverty. I have to say that I'm very lucky because I have been very healthy, but it's not because a fluke. Our genes, and I think nobody's genes is infallible. We are healthy not because of faith in our healthcare system. Well, I must say that we are healthy because of fear. For me, I was so fearful of getting sick, because getting sick means getting scolded by my parents, who were very strict because they were very poor. And being fearful also of the overcrowded but also underfunded healthcare systems in Vietnam, where bribery must be the priority when entering the hospital. And I must say that for many years, my parents just wanted me to have a boyfriend or a husband who is a doctor, because, you know, everyone's want to save money or, from spending on healthcare, or nobody wants to go to hospital. We even have a colloquial saying that a hospital is a cemetery. So talking about health is more haunting for me than interesting. However, I've survived my childhood without any health problems, thanks to my parents' resourcefulness. And also my parents learn a lot about health on a daily basis on internet. Now I have become different. I have language skills, I have internet, and of course I have mentors from different parts of the world who taught me about health. Now I have become a writer, and as a writer, I cared about my well-being, and health is actually one of the topics that I deeply care about. Julia, you asked the last questions about funding priorities. What should be the funding priorities? It is actually our responsibilities as a writer or journalist to inform funders about what should be funded and what funding priorities should be. I remember last year, no, not last year, 2 years back, I attended a conference on internet. And I realized that everybody talked about online gender-based violence. It is because the funders were focusing on online gender-based violence. Then many civil society actors became interested in the topic. Then I had a question to funders, why you cared about online gender-based violence? They told me that because they heard from the media. So yes, the media has a responsibility to inform and to inspire funders on what should be funded. I stop it there, and maybe I just want to tell you one thing about Vietnam. Well, I hate the proverb in English, like an apple a day keeps the doctor away. I think it's a very context-specific proverb. In Vietnam, we have the saying that a smile is equal to 10 doses of medicine. This is doable and much more easy than an apple. So just keep smiling, and I leave it to Lu.
Thank you, Eliza. Thank you so much. Actually, what you just said about, smiles that keep illness away, it actually reminds me of this Vietnamese monk teacher, Thich Nhat Hanh. I love his books. I love his philosophy, and it's practicing mindfulness in every little things. And yeah, so thank you for sharing that. And I see Wilfred raised his hand. So over to you, Wilfred. You are still on mute. You have to unmute yourself. Is it working?
Yeah, can you hear me now?
Yes.
Yeah, so I would like to react to two things. The first one is about something we talk about, corruption. I used to work with Ministry of Health in Burundi, but also in Uganda. I will not call it corruption because corruption is somehow pejorative, and it's not something we as young professionals should be adept of. Either I will talk about maybe lobby strategy, because when you are dealing with people, you need first of all to understand the context. And most of the time within Africa, the first problem we face when you are dealing with people from the Ministry of Health is how they live, for example, their wage within the Ministry of Health. You find out that their wage is somehow unfair. And for example, when you're asking, for example, a service, you want maybe to go on the field with some technician from the Ministry of Health. So this kind of additional efforts you want from them to help you to achieve your goal as working, for example, within an international organization. So you need to put yourself in his place and think about, okay, I'm giving him maybe additional work. So how can I be more grateful? How can I thank him to these efforts? So this way it comes from your good sense to maybe give him something, maybe share something with him. If it is a beer, for example, we in Burundi, I'm coming from Burundi, people used to say, if you want to discuss something more important, we need to sit together maybe in the evening and then share something like beer. So you need to understand this kind of thing, connect with them, but not really engage in this kind of corruption, because if you engage in corruption, like providing money, everyone, they will share that when you are coming, you're gonna give money. So everyone will look or we run after you because you are giving money. And in the end, we end up by not delivering because you will lose your budget, and the cost effectiveness in the end will not really be reached. So for me, I will not say corruption, but I'll say, okay, we are going to do lobby just to make our project more effective. And the second thing I would like to react on is about media, how we use media. When you are talking about health is for me, something which is very sensitive. And when we are talking about national priorities should be defined as priorities based on evidence. And in health, when we are talking about evidences, for example, about research. So again, if we link this one to context, for example, in Africa, we found out that we don't do a lot of research. And most of the time, national national ministry of health are not well informed because we are not doing good research. And there, we need to be more cautious when you are taking information from media, because media also need to be informed by research. And they actually public health professional, they have also skills to translate what is from research to maybe lay information for public, for the general population, what should know media from the research. So we need this link between media and which is in the evidence through research. So I do agree with Eliza when she's highlighting the place of media to inform government, to inform population, to inform founders. But first of all, we need to increase our ability to do research, particularly at the national level, so that we can take evidence-based information. Yeah, this was my comments and insight. Yeah, thank you.
Dr. Ulia, please go ahead. Thank you. Thank you, Wilfred.
Yes, yeah, Wilfred, I completely agree. And if you allow me 1 minute, let me give an example of what I call corruption. Well, corruption is very well defined, for example, in when you sign a contract with a funding entity, when you do the bidding, when you do personnel consultant selection and whatever. Yeah, but sometimes somebody comes and say, hey, you are looking for a consultant in nutrition. This guy is very well trained and he's a cousin to the minister, for example. Okay, somehow you have to be politically correct and you have to do it, that kind of thing. Or maybe, okay, you get to a village and you invite everybody for a drink or things like that so that things can be moving on. Sometimes also you have to do a supervisory visit to a place far away and they pay you $100 per night that you are out of the city, of your base. And somebody say, hey, this one could be very helpful as a supervisor. Okay, you take him as a supervisor, that kind of thing. Regarding the media, yeah, that what Wilfred said is very, very important. I have gone through a couple of situations. It was not me, luckily. I would never do that. Because I feel it's not my information or my data, and every country is entitled to have their own secrecy, as I may say. But somebody have been talking to a journalist that got there and wanted some Jewish information, and travel was big. Travel was big for both of them. So yeah, be very cautious and especially be very considerate. Okay, because that is not your information, that is not your country, that is not your house.
Thank you, Dr. Ulia. And maybe I can invite Dr. Zacharias and Dr. Fitzgerald to share some comments before we try to summarize and close the event today. Who would like to go next or go first?
Go ahead, Dr. Zacharias, and I'll jump in afterwards.
Oh, I was thinking about you being the first. Well, you finished. Yeah, I agree to everything that has been said. But regarding the last issue that Julia mentioned, don't be a devil, but don't try to be a saint. We're human. So you move in that spectrum. Try to be more towards being good, being a saint. But you have to be resilient, and you have to be not only understanding, but also forgiving, because you don't know. And again, I agree. Sometimes you have to work with bad people, but bad people can do many good things, and you really charge what you are charged with. Make the bad good, of the good better, and the better the best. That's your function. That's your function. And what was mentioned about being a consultant, or what you should do in global health or environmental health or whatever, human development, uh, please try to apply your talent to that. Not only your knowledge, but your intelligence, your sensitivity, and always look for equity. Always look for diversity, acceptance of diversity. And that includes people that you don't like, because you are going to be working with people you dislike. But if you can do something good, please do it. And the last thing I wanted to tell you is that what we do at MultiPOD, again, as I mentioned before, help you to find your pathway, opportunities, and get the opportunities, and then make the decisions that you will make in your life. All of us have to make decisions constantly. And we base our program on the answers to 9 questions, and very rapidly: who you are, what is your ikigai, that means your vocation, your profession, your mission, and your passion. Those 4 things you need to find. And if you find a way of combining everything, you are in business. But don't worry, because your ikigai is going to change. Mine took me at least half a century. And finally, at age 70, I found that my vocation was to be a mentor. And I had been a mentor for 30 years without knowing that, without knowing. Then, regarding opportunities, how do you know what you want? Especially this generation. It's very difficult. You have so much information, so much things, and you are all multipotentialites. You have so many interests, so many things that you want to do. Don't worry, do not worry. You can do whatever you want. In my time, you were a doctor, you knew how your life was going to develop. You wanted to study medicine, you knew all the subjects that you needed to take, and then I knew my life, but I didn't expect to do what I'm doing now. Never expected that, but I'm really, really very satisfied with my life. And the last part is, how do you make a decision? And when do you make that decision? And finally, how do you know that that is the right decision? And again, what Dr. Julia said, time. You're in the spectrum of time. And when I was a child, life expectancy in my country was 54 years. You are going to live close to 100. So do not worry. You have from 60 to 80 years to go, and try to work all the time, even if you don't know that you are working. And everything that you learn in life is going to be useful. Your mistakes, your successes, your failures, everything makes you human. And that's the most important part. Okay, so Dr. Molly, please.
Sorry, I forgot that we should have left you with the last word, because you always leave us feeling so good and inspired. So thank you so much for that. And thank you, Dr. Julia and Trung, for sharing your perspectives, and everybody for the really good questions. I guess the one thought that I had listening and thinking about these things is that especially the questions around corruption, because I think that gets into power dynamics, which is at the core of global health certainly right now, which is something I'm very focused on. And being in a country that has been, abusing power and is even continuing to abuse power, I'm sort of trying to find a silver lining, which I think is that the power dynamics are shifting for the better. So, things like when we talk about corruption, I think there's a perspective in it, and there's things that, I guess I shouldn't say this because this is being recorded. But you might consider hypothetically that there could be a country hypothetically that has been very corrupt and continues to be very corrupt hypothetically, and that might not be called corruption. So it's just a certain thing to think about. But also the other thing, just as we go along in life, I think the more you realize you don't know anything, so you kind of it's just useful to think about, like, you don't know what you don't know. So the more I go along in life, I realize the less that I know, and I look back at things that I thought I knew, and I realize I didn't know them at all. So I think that the exciting thing about that and the opportunity is like how interesting and how amazing it is to get to go on this journey. And the more you meet people, especially in a place like MultiPOD, where we're meeting people with all these different perspectives, like the apple a day and the smile, I haven't ever heard that, Tring. And so I just love that, because I think it's completely scientifically backed. In fact, it is actually. I think there's more and more science about smiling and connecting with people, and joy, and the point, and the real actual very substantive value of joy. Joy in resisting things, joy in longevity. And so, yeah, I just want to encourage everybody to continue to learn and be curious, and know that even if in global health and other spaces, there has been an emphasis on, experts and things like this, like, in reality, that's not like an ideal way. And so hopefully we'll move in a better direction. And you all are very inspiring, and thank you so much for coming to join this conversation.
Thank you, Dr. Fitzgerald. And I see Elisa raised her hand, so let's invite Elisa. Thank you.
I just want to I just want to contradict Fernando on one point. He said that the application form consists of only 9 simple questions. I don't think it is simple at all. It took Shakespeare 2 years to publish the play To Be or Not to Be. And then your first question is who you are. How do you define yourself? No, it was not a simple question at all. Yeah.
Thank you, Elisa. And Dr. Ulia, would you like to conclude if you have any more wisdom that you'd like to share with us quickly? Thank you.
Not for now, but let me think for the next one. Maybe I can come up with something else. But it's been my pleasure. Thank you for the opportunity. I apologize again not for having so much time to prepare all this, and hope to see you around in Madrid if you come by any chance.
Thank you so much, Dr. Ulia, and thank you everyone for joining. And before we close, I want to invite our Vice President of CGHI, Yelena, to also share her comments. And I love when Dr. Ulia said, Dr. Zacharias made her time at PAHO better. So Yelena definitely also is making my time at CGHI much better. I would not have, continued to be the president of CGHI without Yelena. So let's invite Yelena to share some comments.
Thank you, Charlie. That is a huge compliment. Well, first of all, I want to thank Dr. Julia for the. I would not say that this was like done without preparation. I think we all benefited from just listening to you and to the inspiring conversation that followed after your short speech. I think, being in CGHI and having done this sort of collaboration with MultiPOD for a few times now, I think that each of these conversations inspires me even more, because we get to sit here with another maybe new and group of people. Like each time it's a different set of people with a few familiar faces here, but I think each time we get to learn something new and to hear, different stories from all around the world. And I think that's one of the most amazing things that we all can be thankful for here, because it reminds us that our context might not be the same as someone else's. And I'm really grateful to be able to sit here with all of you and get to hear, maybe we're talking about the same thing, but it is not the same in all of our countries. So I think that, just being able to sit here and listen to all the different experiences and just, having a lot of food for thought, that will keep us going and doing more, and, making the world better one step at a time. So, thank you I would say to all of you, that have taken an hour and 20 minutes to just sit here and, share your thoughts about all of the different things that we have covered today. I think I'm definitely looking forward to the next conversation, and I hope to see all of you join us again. Back to you, Charlie.
Thank you, Yelena. So yeah, just quickly, thank you everyone for joining us today. And please keep in touch. Feel free to email us, message us anytime, Yelena and myself. And find us on LinkedIn, Instagram, join our WhatsApp group, and check out MultiPOD. Share the word, spread the word. They are looking for new mentees, so be the next one. Yeah, thank you very much and have a great rest of your day. Until we meet again. Bye.
Bye-bye.
Yes.
Bye-bye.
And please save
Thank
the
you.
recording of the meeting.
I will. Yes. Thanks.
Bye.
Bye.
Thank you,
Bye,
everyone.
everyone.
Bye. Bye.